In both the numbers of positive COVID-19 cases and the deaths, the city of Albany, by the numbers per capita, is one of the most intense hotspots in the nation. Looking at the official numbers put up by Johns Hopkins University, as of Friday, the Albany metro area has a population of almost 147,000 people. There are 681 people who have tested positive for COVID-19 and 39 have died. That means there are 27 deaths per every 100,000 residents. The Albany metro area is Dougherty, Lee, Terrell, Worth, and Baker counties.
We continue to see a large influx of patients coming into our emergency room with symptoms of COVID-19.
Compare that per capita population to other hotspots around the country, and the Albany numbers are shocking. New Orleans metro area has 8 times more people than the Albany metro area, with more than 1,270,000 people. They have more than 6,500 positive cases and 241 deaths. That is 19 deaths per 100,000 residents. The hotspot getting the most attention is the New York, New Jersey, and Pennsylvania area, with 19,215,000 residents, 130 times more people than the Albany area. They have 106,025 positives with 2,365 deaths. That's 12 deaths per 100,000 residents, less than half the per capita of Albany. Dougherty County alone is one of the tops in the nation in both positive test results and deaths from COVID-19. As of Friday, 38 people in Dougherty County have died. 81% were African American. Most of them were women. The age range from 34 to 98 years of age. As of Friday, Johns Hopkins University is reporting that Dougherty County has 521 positive cases in a population of more than 87,000, and those numbers continue to grow.
We need to acknowledge the suffering that is going on every day because there have been way too many deaths.
New York and New Orleans all have much larger numbers of hospitals and medical facilities than Albany, with larger numbers of ICU beds. But when you calculate using the per capita numbers, Albany's 60 ICU beds is actually 38 per 100,000 people, better or in the same range of individual counties. But the larger cities' counties have other surrounding counties with more ICU beds available. Phoebe is bringing in more ICU beds and staff this week. Medical officials say Albany's COVID-19 crisis started earlier than most communities and has intensified more quickly. Now those Albany officials are working with the governor, bringing in more National Guard and state medical personnel to help what is now one of the most intense hotspots in the nation. And as you can see, the sidewalks and the streets in Albany very quiet on a Monday morning as another week of this COVID-19 crisis begins in the Good Life City.